Hello, everyone. I go to school in New York, but I'm from Korea, South Korea. Hi. Hi, Jay. It's so weird when one person comes in, everybody comes in together, and when there's nobody, there's nobody. You guys text each other. Hey, let's go in. You're from India. Are you a student? Oh, this one? This one is Air Max, Apple. I put a case on, and the top too. Oh, you are a student. What do you study? Oh, thank you. They hurt my jaws over time, though. How old am I? How old do I look like? Because I'm telling you, you guys text each other. You guys definitely text each other. I think everybody knows each other. You guys come together and live together. It's about time. Hey guys, let's leave. I told you, see? I'm right. I told you. You speak Hindi? It looks like you're writing in English. You're writing in English though, right? I'm studying podiatric medicine. Check out my page. I'm a medical student. Jay, you're not going? No. I'm like, where are you not going? Oh, you speak. You're bilingual, like me. Somebody has to tell me why YouTube is keep kicking me out after like 5 minutes. Oh, thank you. Brain and brains, brain and beauty. Trying, 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 trying. Hi, welcome. Thank you for subscribing. Subscribe dance. So good. Well, thank you. Subscriber dance. Subscriber dance. You guys like the subscriber dance? Subscriber dance. Hopefully we get a new subscriber. You guys don't get to see that awesome dance until you guys get a new subscriber. I'm trying to post more videos, but honestly, with all these exams, clinical rotations, all these classes, workshops, it's so hard. I'm so sorry, guys. Hi, Edion. Eddie only boy. Hey, Jay Smith, don't lie. I get a notification. I didn't see a new notification. My network is not working? Am I lagging, guys? Am I lagging? Yeah, I'm in medical school. Podiatric medical school. I deal with your feet. Anybody need a new insoles? Hit me up. I'm a third year. Third year. Out of 4 years. I just started third year though. Third year just started, so technically 2 more years. Plus 3 to 4 year residency after graduation. Long way to go, guys. Long way to go. Which means long way to grow my channel, right? Yeah, it does go by really fast. What's Roblox? What's that? Is that a game? Is that a game? Whoa, what did I do? You guys want to see my beautiful cup? I like Stitch. Yeah, Eddie only boy. Your word looks weird, yeah. I have this, I don't know why it automatically got installed, but the Nightbot is like not allowing people to like spam. I want you guys to spam. I don't know how to get rid of that. Sorry. What do I like to do for fun? I've been learning how to surf. Sorry, you kicked me out again. For fun, I like surfing. What else? I'm also starting to learn a little bit how to ride a skateboard. Oh, Roblox is an online game. What kind of game? I don't really play games. I'm not really into games. I like physical activity stuff. Hi, Erin. Hey, I did the new subscriber dance for you. See? New subscriber dance. No, I'm not from South Korea. I was born and raised there until 5th grade, and I came here. I live here. Now I'm American. I've probably been in America for a longer time than I was in Korea. It's a game to have multiple games on it. Interesting. Yeah. I don't I don't really play games that much. I don't really get a chance to play games, to be honest. I wish I could play game all day. I visited Korea. I don't go often. I went to Korea for the first time after I came to America last year. It was great. I went to Busan. I went to Hongdae. Haeundae in Busan too. It was so great. When you go to Busan in Korea, you have to go to Haeundae. It's beautiful. My name is Natalie. My Korean name is Nayoung. Thank you. Any suggestions for my channel, guys? For something that I can manage with the medical school. We have exams every other day. Like, not every other day, but like every 2 days. It's insane. Yep, I was born in Korea. I was born in Busan actually. And then I moved to Seoul after like when I was like 2 or 3. So my hometown is Busan, technically. Thank you, JC. Do a life in a med. Yeah, I think, yeah. Honestly, I feel like I need an editor or something. It takes so long to edit everything. That's why I'm doing live more often, because not only that I can talk to you guys like more freely, I don't really have to edit it, so. Maybe I'll do a life in medical student life. I did some of the shorts about that, but it's been a while. It was before I took the boards, so maybe I should do one. Thank you. Thank you for the suggestion. Hi, Jay Smith. Where'd you go? Where were you? You are working in job? You are working in job? Huh? Check your grammar one more time. Try again. Yesterday, one of the patients, I was at the computer, and the nurse usually I rotate in like 4 or 5 different hospitals, and in this one hospital that I was in yesterday, they the nurse brings the patient into the room, and she was like she had like really bad edema in both of her legs, and like she was only like in her early 30s, and she looked like totally fine. She came in with her boyfriend, like she was happy, and she was just worried that her legs, her foot health. And I was typing when she came in, and then I finished my typing and then turned over. I was like, "Hi, how are you?" And she's like, "You're so beautiful." I'm like, "Thank you. You made my day." But then like she ended up having like depression. Like she was like, "I don't know. I had like it's hard for me to get out of my bed." And yeah, she like you never know. But what I wanted to say is she made my day. You know, she was like, "You're beautiful." You guys remind me of that. Oh, what class am I studying right now? I'm studying for radiology. Let me show you. Type. Like this stuff. All the good stuffs, guys. Good stuffs. Good stuffs. Good stuff. There's so many angles that I have to memorize. I don't know how I'm supposed to memorize all these angles. Bye, Jay Smith. Um, like I guess different types of fractures, osteophytes, um, like different overgrowth of the bones, um, like what causes overgrowth, what causes like What causes fracture, osteopenia, like scurvy osteogenesis imperfecta is due to the collagen abnormality. Ooh, you're a YouTuber. Is this your account? Is this your... Give me some recommendations. For calcification, Flabolis, Mockingbird sclerosis, atherosclerosis, calcific tendinopathy, generalized calcinosis, metastatic calcinosis, they're all due to calcification. Ooh, I'll check it out. Let me check it out. Let's see. Let's see. Eddie only boy. Ooh. Oh, you play games. Cool. Wow. The medical diagnosis content? Like differentials, clinical workups? Yeah, maybe I should do that. That's a good idea. And it would also help me study. Because I would have to know what I'm talking about to do that content. Guys, make sure you take vitamin D if you're low in vitamin D. Otherwise, you're gonna get osteomalacia. Yeah, you're right. I heard somebody. My shirt. My shirt? I don't even know. Wild Soul Classic. Classic? It's a car. It's a car. No, I'm not into racing. My brother's really into cars. He's really into cars, like he knows everything about, like, well, I don't even know what to say, but like turbo and everything. He has a Corvette and Evo. don't ask me the cars. I don't know the cars. I just thought the shirt was cool. Isn't it cute? Yep, I have an older brother. General bilateral osteopenia. It's due to decreased mineral density type 1 type 2. Yep. Thank you. And I'm wearing a cargo pants today. Let me show you guys. Cargo pants. I don't have a sister too. I prefer a brother though. I would fight with my sister every day. Give me my shirt! I told you to stop stealing my shirt! You told me I can wear this! This is a cute shirt! I'll be like looking at my notes here and there, but just put it in the chat. I'm gonna look at the chat and then answer any questions you guys have. Parathyroid adenoma, major cause of primary parathyroidism. Parathyroid gland, increased excessive production of PTH. Increases the calcium in the serum. Okay. So there's something called parathyroid adenoma. It's caused by, so PTH is parathyroid hormone, and PTH increases calcium. It works to increase calcium, so your bone gets like larger. You get more bone, and decreased bone resorption. So if you have parathyroid adenoma, it means that you have high PTH and higher level of calcium. So in that case, if you have an adenoma, you have to do a surgery. You basically have to do a surgical removal of the tumor. This is coffee. This is lemonade. So I'm like, both. When I was studying for the boards, I had a decent number of people watching me, like 30 people watching me at one time. I guess I shouldn't take a break, right? And you guys all come at the same time. You guys all leave at the same time. There's a wave in everything. How do you pin the comment? You like my necklace? Thank you. I just got this. It's a turtle. How do you pin? How do you pin? Do you guys know what the difference between parathyroid adenoma versus brown tumor is? I'm sure you guys don't care what that is, what the difference is. Yeah, right? Such a beachy vibe. I want to dance the new subscriber dance, but nobody's joining me. I know you guys miss it too. Too bad. It's a teamwork, okay? This is a Hindi. What is the card? I think your translator, Eddie Only Boy, your translator is a little off, to be honest. Guys, we need more people. Parathyroid glands are 4p sized. Is it? That's never heard that analogy. Ooh, I see what you mean. You're teaching me. Teach me more. More. Yeah, do you know parathyroid adenoma versus brown tumor? User WN7BM6VV7Q. What a long, complicated name. Consequence of untreated or severe increased hyperparathyroidism. Bone resorption, formation of cystic lesion of the bone. Okay, so brown tumor is when you have like crazy amount of thyroid, then you have a higher bone resorption formation, and it forms a cystic lesion in the bone, and that creates the brown tumor. But it's not a true tumor. It's like a focal cystic area of a bone destruction. Brown tumors are associated with increased PTH levels. It says, due to severely increased hyperparathyroidism. Yeah. Yep. So if you have higher PTH, you have if you have a severe hyperthyroidism, you have increased bone resorption formation. It's kind of counterintuitive because if you have higher PTH, right? That means that you have higher calcium. If you have a higher calcium, it would be decreased bone resorption. But the note says increased bone resorption formation. So I would think that that's occurring because like it's a severely high, so it's like kind of like the negative feedback is kind of messed up. Oh, thank you. Because if you have a higher PTH, it's supposed to have increased calcium level, therefore decreased calcium resorption. But it's the opposite. Why? Because it's severe hyperparathyroidism. Ha ha ha. And brown tumor is not a true tumor. The treatment is to treat the underlying cause of the excessive PTH production. I don't have a set of time that I come on live because my school schedule itself is not like what do you call it? Like it's not like same every day. They give us 4 different schedules. One for medical imaging class, one for podiatry medicine class, one for clinical rotation, and one for... Hi! How's it going?
How's it going?
Where are you going?
Right there, all night.
All night? My classmates just joined us. Sorry about that. Resulting in hypercalcemia. Oh, I'm living at the the dorm. So I'm studying at the lounge. So there are some of my classmates living here, came down to study as well. Who is this man? I'm gonna throw this out in the garbage. No, I mean, we're like the same years. They're my classmates. They scared me though, because I was talking to you guys. Probably thought I was crazy talking to myself. Thank you. Sounds like you're a doctor. Are you a doctor? I think you know more than me. Primary hyperparathyroidism, PTJ, adenoma, brown tumor, aka osteitis, fibrosa cystica, renal osteodystrophy. So now we know the difference between the parathyroid adenoma and the brown tumor. Moving on to osteomalacia. You guys know osteomalacia? So, in adults, causes osteomalacia in infancy and childhood. It results in rickets. My setup is trash right now. Oh, I knew it. User WN7BM6YV7Q. I knew that you're in medical field. I think I'm still a new YouTuber because I feel kind of awkward for them, like my classmates looking at me talking to myself. My setup, there's no setup because I'm at the lounge. I'm at the lounge. This is all I have. That's all I have. But I do have a setup when I go home, like upstairs. Osteomalacia in adults, osteomalacia close to physis, infancy and childhood rickets. Your rickets open physis, disease of bone quality, only 40% is mineralized and calcified instead of 99% in the bone. This is osteomalacia, softness of bone, vitamin D deficiency. X-ray is loser zone. Okay, osteomalacia, the bone quality is only 40%, decreased from about 99%, which is normal. So you have less bone quality. So basically you have a soft bone and it's due to vitamin D deficiency. And so you have a more radiolucency on the X-ray. In child, it's called rickets. For adults, it's osteomalacia. In adult age, closed physis. For kids, it's open physis. Guys, sorry if I'm acting kind of weird because I have my classmates over there. That's why. Osteomalacia in children, it's called rickets. Yes. Quiz time. How do you test for osteomalacia? How do you test for malacia? Bone biopsy? Bone biopsy? Please, you're giving me anxiety. Quiz time. It's like I'm rounding with you as a resident. So for osteomalacia, in the radiographic feature, you have a bowing deformity in the long tubular bone, and you also get a pseudo fracture. Did I get it right, user? And blood test. Okay, because you would have more like. There's so many people just walking. Yeah, and blood test. You would have higher calcium and protein then. Sorry, I can't do this. Okay, bye, ID only boy. Thanks for joining me today. Join me next time. Yeah, but I get a half credit, right, user? Hey guys, sorry, I got a call. What's the prognosis for Austin, Malaysia? Um, de- um, decrease the PTH level because Austin, Malaysia means you have low in calcium, so you want to increase calcium. So that would be if you want to increase calcium, you want to increase PTH because PTH increases calcium, right? You can give the what's the B one? The bisphosphonate. Bisphosphonate? Doesn't bisphosphonate help with the decreased bone density? I don't know. Hey Natalie, say in Korea. Say what in Korea? 안녕. 안녕. Oh, sorry. I said like bisphosphonate. Doesn't bisphosphonate help with the bone density? Or like directly decreasing the PTH? Because PTH is what increases the calcium level. Like it could be like surgical, or it could be like you can give the drug. And I would think I thought bisphosphonate decreases the bone density. Helps with the decreased bone density, or is it the opposite? I don't know. Leave the answer in the chat. Yes, you're right. Really? No way, I'm right. That's crazy. That's crazy. I'm happy. I'm gonna use the restroom. I'll be right back, okay? Thank you. I guess I'm learning something. So now I'm learning about, I'm still in osteomalacia. For osteomalacia, so it's for vitamin D deficiency, right? It could, in the radiography, it could look like a bowing, or what is it? Pseudo fracture. Um, the pseudo fracture can look like a loser bone or milkman fracture. It's an interesting name, milkman fracture. Um, so moving on from osteomalacia, next one is renal osteodystrophy. Do you know about that user? So renal osteodystrophy is also called uremic osteopathy. It's also called renal rickets. Chronic kidney disease can lead to hyperphosphatemia, so higher level of phosphate, because it's supposed to get resorbed in the proximal disc. Phosphate is reabsorbed um, in the distal convoluting tubule. So if you have a chronic kidney disease, then that would mean that your the phosphate is not going to get reabsorbed well in the distal convoluting tubule. So you're going to have hyperphosphatemia. And that would lead to higher parathyroid hormone. So if you have high potassium, high high PTH, because all of the stuff like calcium, phosphate, they are not getting reabsorbed well in the kidney if you have a chronic kidney disease. That can lead to increased osteoclast activity, breaking down the bone. Because you have a higher PTH, it's gonna try to increase the calcium level in the bone. And that increases bone resorption. So you have an increased level of bone resorption, which means you're gonna have like buildup of bone on top of the stuff, right? You guys see me just like freaking out every time my classmate passes by behind me. Thank you. My God is on fire. That's called renal osteodystrophy. The osteo is dystrophic due to the renal problem, the CKD, because the CKD messes up the distal convoluted tubule, decreases the potassium and calcium, buildup of potassium, that's hyperkalemia. Buildup of calcium, that means higher PTH. Higher PTH means higher calcium, which means higher bone resorption. Higher bone resorption means that you're gonna get osteophytes. So on the X-ray, you're gonna have like a buildup of bone. I should be learning from you. I didn't know what. We're teaching each other a lot today. Because when you're a resident, like what I think is you deal with like a real deal stuff, you know? So like you have to take real deal. So it's a real deal. So you deal with like real patients, like making real diagnosis and stuff. Mm, the next is osteoporosis. It's also called Cushing's disease. Yeah, but it's still so much to learn. Yeah, there's so much to learn. I don't know how much brain can manage to learn everything and remember everything. It's crazy. But you are a resident. What year resident are you? Is your program 3 years or like 4 years? Or if you're like cardiology, you're like 6 years. For podiatry, it's usually 3 years, except for like UPenn is like 4 years. 4 years? Which year are you on? You're like so close. You're basically in the same position as me in residency right now. How's that going? Are you like IMED, internal medicine, or sorry, you kicked me out again. Um, you that's my concern because I feel like I don't know anything right now. And I feel like if I go to the residency, like I'm not gonna know anything either. I'm gonna get yelled at every single day. Gonna call mom and cry. You definitely know a lot though. You're just not like realizing it. But you're see like you're teaching me stuff. You're asking me like hard questions. Sorry, I'm like worried that another person's gonna pass by me. So osteoporosis is also called Cushing's disease. It's due to elevated cortisol level in Cushing's syndrome. So so basically, let me read it first and then explain it to you in my own words. Okay, so osteoporosis is basically like it's also due to vitamin D deficiency, just like what was the other one with the vitamin D deficiency? The osteomalacia. Just like the osteomalacia, osteoporosis is also due to vitamin D deficiency, but also with um, the decreased bone resorption with increased bone resorption. So if you have increased bone resorption, then you're gonna have higher level of calcium in the bloodstream. That means, wait, So this is what literally says elevated cortisol level in Cushing's syndrome, bone resorption, and impaired vitamin D metabolism. What does that mean? Sometimes like these slides don't even make sense. Do you notice? So, oh, okay. So in Cushing's disease, we know that it's due to increased level of cortisol. If you have increased level of cortisol, it um, it decreases the osteoblast. So osteoblast makes the bone. So if you have decreased level of making bone cells, then you're gonna have decreased bone density, which means if you have decreased bone density, it technically also means that you have an increased bone resorption, so more calcium going to the blood. That causes osteoporosis. And if you have osteoporosis, you have increased fracture risk, obviously, because it's weaker. So let me explain it again. Osteoporosis is also due to vitamin D deficiency, just like the osteomalacia. But it also is due to increased cortisol level. So if you have increased cortisol level, like in the Cushing syndrome, you have increased cortisol level means you have decreased level of osteoblast. If you have decreased level of osteoblast, it means that it's making bone less, right? And instead, it's increasing the bone resorption, like more calcium going to the blood, from the bone to the blood, which means you have a weaker bone, therefore the osteoporosis. If you have weaker bone, sorry, it's keep kicking me out. I think it's my internet. But if you have increased bone resorption, you have osteoporosis. If you have osteoporosis, it means that you have weaker bone, therefore increased fracture, increased risk of fracture. Make sense? Make sense? Make sense? Make sense? Make sense? Okay. So we know osteomalacia, we know osteoporosis. Your chat keeps kicking you out, so I missed some parts, but you definitely have the concept. Oh yeah, I also got kicked out. I think we both get kicked out together. I think it's me. I think it's the internet or something. It's keep like kicking me out. It's keep kicking me out too. But to say it again, it helps me too to say it over and over. So osteoporosis, what is it? Just like the osteomalacia, osteoporosis also due to vitamin D deficiency, but also osteoporosis is also called Cushing's syndrome, which means you have high cortisol level. If you have high cortisol level in osteoporosis, it means that you you have decreased level of osteoblast. Osteoblast is a bone making cells, right? If you have a decreased level of bone making cells, it's basically telling you that you have increased level of bone resorption, calcium going from the bone to the bloodstream. So if you have decreased level of osteoblast making bone, your bone gets weaker, which we call that a osteoporosis. If you have osteoporosis, then you have weaker, increased risk of bone fracture. That's all I said. We just have to remember that osteoporosis is related to Cushing's disease, aka Cushing's syndrome. And guess what? It gets more. What did you say? Have you ever done a trabecular bone score to analyze DXA images? No, no. We just literally started taking um, medical imaging one, like the first, like very first radiology class since the third year. What is DXA images? Let me look it up. DXA. DXA images. Oh wow, this is cool. DXA images. Oh, to determine like arthritis and osteoporosis. Wow. This is really cool. Look at that. The high tech 2020 2026. Have you ever used this in person? This is pretty cool. Anyway, it is really cool. I'm looking at the pictures right now and it's like such a high tech. So it basically tells you where you have osteoporosis. That's really cool. Wow. Hey, you need to join my live every single time, user. You teach me so much. And it's really fun to study with somebody, you know? I don't really like studying with my classmates because like we all have different speeds of learning, so if they learn faster than me, like I get kind of demotivated. But I like this. So we killed the osteomalacia and osteoporosis. You teach me so much. I've learned so much from listening to you, and yes, studying with other people helps a lot. Yes. It's good for me if the person that I'm studying with have kind of a same like speed of learning. If it's slower, then I go slower. So like I'm like, oh, like I panic. I'm like, oh my gosh, I have exam tomorrow. I have to like cover this much. Then like you're going, like if that person's learning slower, then you feel like you're kind of like wasting your time. But if the other person's learning too fast, you feel like you don't know anything and you start panicking too. Either way, you panic. But if you have somebody who learns like in the same pace as you, it's perfect. Haven't found one like that. But I like studying with you. It helps me a lot. So we went over osteomalacia, rickets, osteoporosis, aka Cushing's disease, both osteomalacia and osteoporosis are due to vitamin D, not C, vitamin D deficiency. But guess what? They make it even more complicated. Osteoporosis, there's primary and secondary osteoporosis. Either way you panic, is there? Yeah, either way you panic. Sometimes I'm like, is medicine worth it? But I definitely enjoy the patient encounter. Like the patients, when I have a patient encounter, like a lot of patients tell me that, oh, it seems like you enjoy what you're doing, because I like talking to them. But it's just such a long pathway. How long do I usually study for? Like right now, it's kind of a light day. Obviously, like I have a live on, I'm talking to you and stuff. But if I go hard, I just like, we have 7 a.m. class, and then as soon as the class is over, we have to go to the like hospital that we've been assigned for that day, which usually starts at 9. So 7 o'clock class until like 8:45, and then we like take the train to the hospital from 9. Usually it's like 9 to 4 or 5. So like after 5 p.m. I get back home, and then like if I eat and like do this and that and settle down, it's like 7. Like starting from 7, I just study until I go to bed, which is like sometimes like 12, sometimes 1 a.m., sometimes 2 a.m., sometimes 3 a.m. And then I wake up at 6:55 for the class again. It's repeats. Repeat same thing over and over. Over and over. Yeah. And on the weekends I catch up in sleep. On the weekend I sleep in a lot. And then I do like other stuff, like I work out or like I go out to do something fun. Yeah. Oh man. You wanna see? You see, if my friend, my classmate is studying right there. That's why I keep looking there, because it looks like I'm just talking to myself like a crazy person. It's just one person. Just one guy. I don't like studying with other people unless they have like exact same pace as me. And today I just kind of want to go like today it's kind of fun to explain to you. Not gonna lie, kind of fun. So it's like I'm teacher. So do you know the difference between the primary? No, I'm calling them fast. I'm calling them fast. He's smart. He's like in a dean's list, I think. He's really smart. So he's fast. I'm the slow one. Today I wanna like go like surfing. Do you know the difference between the primary and secondary osteoporosis? Oh my god, thank you. I don't believe you, but thank you. Thank you so much. I like learning with you. You like motivate me. So, primary osteoporosis is the most common cause, not the secondary, but the primary is the most common cause, and it mainly affects the trabecular bone. Remember you mentioned trabecular bone? Here it is. Look at that. See? You know your stuff. So, the primary osteoporosis, it's the most common cause, and it mainly affects the trabecular bone. Um, and within the primary osteoporosis, there's type 1 and type 2. Type 1 is type 1 osteoporosis is the postmenopausal, so around 51 to 75 years old. And within primary still, type 2 osteoporosis is senile, so more than 70 years. Okay, that's easy, I guess, right? Osteoporosis, primary osteoporosis, type 1, type 2. Type 1 is postmenopausal, so 51 to like 75. 75? Yeah, 75. Postmenopause 75, is that accurate? Oh well, I trust my professor. So 51 to 75, and the type 2 osteoporosis within the primary osteoporosis is senile, so greater than 75 years old. And the secondary osteoporosis affects both the trabecular and the cortical bone, so inside and out. Primary, just inside. Secondary, inside and out. So secondary is worse, but the primary osteoporosis is most common. So secondary osteoporosis affects both the trabecular and cortical bone. Steroid and dietary differential next most common cause. So it's the next most common cause due to the steroid and dietary deficiency. I'm like, what's DEF? She wrote DEF dot. Secondary is due to underlying medical conditions. Okay. And plus steroid and dietary deficiency. And she said it's the next most common cause after the primary. So secondary is the second most common. 75, that seems to... I know, right? My professor literally wrote, look at this, I'll show you. She literally said 55 to 75 postmenopausal. Is that right? Is that right? Question mark, question mark. I'm like, 75? Even 51 is kind of late. Yeah, but I trust her. I trust her. Okay, so user. We killed osteomalacia and osteoporosis. We're like professors of osteomalacia and osteoporosis. Now, and endoparathyroid adenoma and brown tumor. We learned all of that. Now, there's like, and also we learned hyperthyroidism, like the renal osteodystrophy, like how the CKD increases the phosphate and the calcium level, and leading to increased osteoclast activity, producing osteoporosis. So now she's teaching about the sickle cell anemia. Sickle cell anemia can, so we both probably know that sickle cell anemia is due to abnormal hemoglobin. That's easy. I know, right? Give us the PhD already. God damn it. So sickle cell anemia is due to abnormal hemoglobin. So it increases, no, not increase. It causes ischemia. Do you call it ischemia or ischemia? Ischemia, right? I think that's what my professor says. Ischemia. It causes ischemia and tissue infarction. In the radiography, it looks like you have osteonecrosis. You do have osteonecrosis, irregularity, and serpiginous abnormal lines. So it looks like a foggy, like lines, and it's irregular. That's all she wrote actually. Abnormal hemoglobin leading to ischemia and tissue infarction. Oh, so that makes sense because in sickle cell anemia, like anemia means like abnormal hemoglobin, like low blood, right? If you have less blood, it means like you have less blood, so like your tissues are gonna die. So tissue infarction. Tissue infarction. Yeah, and tissue infarction means what? Ischemia. Yay! And you just have to remember that in the radiography, it looks like irregular. You have osteonecrosis, like bone death, and serpiginous abnormal lines. What causes sickle cell anemia? There's like what is it? The shape of the hemoglobin, right? It look instead of like biconcave, the hemoglobin is like popped. So that means you have what is it called when the blood when the water is going out? Hyperosmotic, right? Right. There's another one called Cooley anemia, and that has to do with the thalassemia. Yeah, I got it right. I'm telling you, I know my stuff. Give me PhD already. You're increasing my confidence level. So Cooley anemia, which is also called thalassemia, is abnormal hemoglobin synthesis. So the difference between the sickle cell and the thalassemia is that in the sickle cell is the anemia, so like decreased blood hemoglobin, like red blood cell itself, while the Cooley anemia, which is aka thalassemia, is due to the synthesis, abnormal synthesis of hemoglobin. Not the shape, but the synthesis of hemoglobin. So there's, she only mentions the thalassemia major. She doesn't mention the minor, but she says that the thalassemia major is most severe and most common radiographic features. It looks like a honeycomb appearance. If you know how that looks like. She said thalassemia major looks like a honeycomb appearance, like that bee, the honey thingy. That's all she wrote. And she gave me like example picture. And osteopenia with decreased bone collagen abnormality. So what are the two examples of osteopenia? Tell me. 10, Let me see. I think there was like a countdown that I can give it to you. Countdown. Countdown. What's this? What's the question again? I said, what are the two examples of osteopenia with decreased bone collagen abnormality? I'm sorry. Do you want to skip? You can skip. Let me just tell you the answers. It's osteogenesis imperfecta and scurvy. You probably knew it. Um, so, osteogenesis imperfecta. So in osteopenia, if you have scurvy or osteogenesis imperfecta, you have those abnormalities because you have abnormalities in collagen. I would have gotten them wrong. I didn't know about that. Like I should know it. Like we learned this, but like who wants to remember about like osteogenesis imperfecta is due to like um so it's saying that osteopenia causes increased tendency to fracture, which makes sense. Like in scurvy and osteogenesis imperfecta, you have increased tendency to fracture your bone. Clinical presentations may mimic abuse. Oh, interesting. So she's saying that for osteopenia, if you look at the radiography, it looks like you have increased, like it looks like it looks like you got abused, basically. It looks like you got abused. Okay. So she's saying that radiographic finding for osteopenia is coarse trabeculations and decreased bone girth over tubulation, flared metaphysis, and fractures with exuberate bone callus. That's really confusing. Coarse trabeculations. This is so sad. Nobody wants to learn about osteopenia and osteomalacia. It's just us two. Yeah. So radiographic finding for diffuse osteopenia is coarse trabeculations, decreased bone girth over tubulation, flared metaphysis, fractures with exuberate bone callus. So, I don't get it, but I'll pass. I'll pass. If there's no chance, pass it. All I remember about osteopenia is that it can look like it can mimic abuse. That's it. That's pretty interesting. And it's kind of impressive, like for you too, because like for you, like you're probably like during your like your rest time, you should be resting, but you're here like on the YouTube trying to learn. Like that shows like how much you like you're fit for this. Like you're always like trying to learn even when you're on a break. That's like really impressive for me. Like who would want to stay in like hear about this girl like explain about osteopenia, osteomalacia. Like it shows that you're like really into this. Osteogenesis imperfecta. Let me try to find the question. I study with you. Aww, thank you. So let me read about osteogenesis imperfecta and explain it to you. Okay. Okay. So basically, so both osteopenia and osteogenesis imperfecta are due to abnormal collagen level. So, but the difference is that the difference is that osteogenesis imperfecta. Yes, you got it. You're smarty pants. You got it before I even said it. So osteogenesis imperfecta is a brittle bone because it's a genetic disorder too. Unlike the osteogenesis imperfecta is an example of osteopenia. My bad. So so obviously they're both due to collagen abnormality, but osteogenesis imperfecta is genetic disorder, and that you have a brittle bone, like you said, and it's a deficiency in collagen, like complete deficiency in collagen. And you got the keyword, like she literally highlighted what you said, brittle bone disease. Like she literally wrote brittle bone disease. Let me show you. She wrote, how do I? Oh. She literally wrote brittle bone disease. See, you killed it. You killed it, doctor. Do you know the 8 types? Oh, like the blue sclerosis and stuff? She mentioned it, but she mentioned 4. Is that what it is? Like a blue sclerosis, blue sclera, then tenogenesis imperfecta, hearing impairment, osteoporosis with abnormal bone fragility. But there are 8? That's crazy. She mentioned only 4 here. Like clinical features. So brittle bone, blue sclera, deformed teeth, brittle bone. Let's see. Okay, thank you. Thank you for joining me. Maybe I'll go too. Yep, I hope we can link again. Thanks for joining me. Bye. Sounds good. I'll hang up too once you leave. And really lock in. Good night. Bye. I'll hang up in 3 seconds. 3, 2, 1. Bye.